What's up, beautiful people? Another day, another study. I'm sure you've heard of the forever chemicals. These are PFAS. These chemicals are found almost everywhere. One study said that 98% of people have positive levels of these in their blood. Typically, exposure for most people is through drinking water. However, there is also occupational exposure. People like firefighters, military, people who work in food processing, because they're often found in the wrappers that processed foods are packaged in, and people who work doing carpet installing. So those are some occupational exposures, but environmental exposure mostly comes from drinking water. Now, previous studies have linked higher exposure to other metabolic conditions, but the link to diabetes was inconclusive. This was a nested case control study where they looked at metabolomics, where they were trying to figure out if there was a biological cause for the increased risk of type 2 diabetes. So, over an average of a 6-year follow up period, higher exposure to the forever chemicals was associated with a 31% increased risk of diabetes. And in the metabolome analysis, pathways associated with certain amino acid metabolism as well as drug metabolism were linked to both the exposure to the forever chemicals and type 2 diabetes. And this indicates that the exposure may influence diabetes risk by altering amino acid and drug metabolism pathways. And there are some epidemiological studies that support that as well. As far as metabolites goes, there was a bile acid conjugate that was associated with both with PFAS exposure and type 2 diabetes. And bile acids play a crucial role in regulating lipids and glucose, drug and energy metabolism. So, what can we do about it? The number one thing is drinking water. So, filtering our drinking water, reverse osmosis can help. And those who have occupational exposure, we think it's mostly through contact on the hands and then we eat and stuff like that. However, there may be inhalation exposure and skin exposure may be another route. It's not really clear. Now, this was a small study. It wasn't longitudinal. It relied on EHR data, and then metabolomics can be misleading and require experimental confirmation. But overall, it adds to the body of literature showing metabolic disruption from the forever chemicals.